Introduction to intravascular blood coagulation by Disseminated. Okay, so in the content, so let's talk about the introduction, basically the meaning, diagnosis, pathophysiology, coagulation cascade overview, causes of DIG, clinical features, clinical forms, and conclusion. Okay, so introduction. Intravascular blood coagulation is also known as disseminated intravascular coagulation. That's where the name came from, DIC. And it's a common state in which a combination of thrombosis and hemorrhage complicates another disorder. It's often secondary to various underlying medical issues like infections, trauma, and malignancies. Okay, so this is a picture of what it looks like. Then activation of coagulation leads to formation of microthrombi in numerous organs and to consumption of clotting factors and platelets in the process of clot formation, which in turn causes hemorrhagic diathesis. Diagnosis, so how to find out whether one has laboratory tests support the diagnosis. We have low levels of fibrinogen, elevated fibrin degradation products, that's the D-dimer, decreased platelet count, prolonged prothrombin time, and activated partial thromboplastin time. Pathophysiology. There's endothelial damage. Damage to the endothelium exposes the tissue factor. Hence, there are substances in the bloodstream which coagulate. There is activation of coagulation. The tissue factor activates the intrinsic pathway of coagulation cascade, which generates thrombin. Then there is formation of fibrin clots. Thrombin converts fibrinogen to fibrin, forming fibrin clots within the microvasculature. Then microvascular thrombosis. The clots obstruct the small blood vessels, causing ischemia and organ damage. Then there is consumption of coagulation factors. The widespread formation of clots consumes platelet coagulation factors, leading to a deficiency. Then activation of fibrinolysis. As the fibrin clots attack the body's attempt to break them down through fibrinolysis, increase the levels of them in the blood. Then there is bleeding tendency. The consumption of clotting factors and platelets, along with high levels of fibrin degradation products, causes a bleeding tendency. Then there is fibrinolysis. Activation of fibrinolytic system to limit fibrin spread. Then we have stages of DIG. There's hypercoagulation and platelet aggression. There's increasing of coagulopathy. There's hypocoagulation and recovery, the last stage. And this is a picture of what we discussed previously. Then coagulation cascade overview is divided into three main pathways. There's the intrinsic, the extrinsic, and the common pathway. The intrinsic is within the blood vessels. Extrinsic is a factor which there's damage of tissues. And the common pathway is where both intrinsic and extrinsic lead to formation of fibrin. Another diagram to show you the pathogenesis of DIC. Then causes of DIC. The first one is infections, which includes gram-negative bacteria, sepsis. There's also cancer, mostly adenocarcinomas. There's trauma, such as injuries, burns. There's obstetric complications like abruptio placentae, septic abortion, and other triggers like sleep balloons, immune complex diseases. Then clinical features of DIC. We have organ dysfunction, and under the organ dysfunction, it can be cardiac, it can be respiratory, it can be renal, it can be neurological, and it can be hepatic. There's hemolytic anemia. There's bleeding from mucus and skin into serosal cavities and into the internal organs. Then there's hematuria, which means blood in urine. Then this is a picture. I think Tofumi already talked about this, the potassium, purpura, so much more lights. Then the chemical forms of disseminated intravascular coagulation, there's lighting fast, which is 1 to 2 hours a day, septic shock, emboli. Then there's acute, 1 to 2 days to 7 to 12 week. Severe sepsis. There's subacute, 1 week to some months. Intrauterus death of the fetus, virus hepatitis, or myeloid leukemia. Then there's chronic, which is less than a year and more. Cirrhosis as well. So treatment is largely by removing the underlying cause and clotting factor and platelet replacement. But we'll talk about more treatment procedures. Yeah. So to treat the patient, you have to first address the underlying cause. You have to find out the main cause of the infection and manage the trauma. Then there's anticoagulation therapy. Then there's also supportive care, which includes blood transfusion, platelets, and fresh frozen plasma. Then to conclude, intravascular blood coagulation represents a critical clinical syndrome with significant morbidity and mortality. Many people can die from this. And understanding this is important to manage it, to diagnose and to treat it properly. And continuous research is necessary to improve the outcomes of the condition. So you need to research more to be able to find ways to treat the disease. Then this is a picture to give like a brief overview of everything: the definition, the etiology, the diagnosis, the management, and a picture of someone who is suffering from this. Thank you.